2, 1. All right. So according to the American College of Sports Medicine, more than 25,000 Americans suffer from an ankle sprain every day. Today, I'm going to be performing a closed fast weave ankle taping for an inversion ankle sprain. Now, an ankle sprain occurs when too much pressure is placed on the ankle or it is twisted for some reason. There are two different types of ankle sprains. An inversion ankle sprain, where your foot would roll inwards and you would injure one of the lateral ligaments on the outside of your ankle. The most commonly injured ligament in an inversion ankle sprain is the anterior talofibular ligament. The second kind of ankle sprains are eversion ankle sprains, where your foot would roll outwards and you would injure one of the deltoid ligaments on the inside of the ankle. Now, because your lateral ligaments are so much weaker than your deltoid ligaments, 80% of ankle sprains are caused by inversion. Now, while this taping will do nothing to help heal the injury, it will help provide support to the ankle and help to prevent a future injury. So today, I'm going to be using Johnson & Johnson 1.5-inch Coach Athletic Tape, pre-wrap, and heel and lace pads to help manage this injury as the athlete progresses through the rehabilitation process and returns to play. While there are many variations on this form of taping, all the modified styles include heel locks, stirrups, and figure eights, which, when combined in an interweaving fashion, are vital techniques to providing stability and strength to the ankle. So to start off my taping, I'm going to use these two heel and lace pads, which will help reduce blister-causing friction. I will now apply pre-wrap, which will help avoid the athletic tape from irritating the skin. I'll start the pre-wrap at the flare or bottom of the gastrocnemius and work my way all the way down to the bottom of the toes, while making sure to completely cover everything in between. I will now apply two proximal anchors. And one distal anchor. I will now apply 3 stirrups and 3 horseshoes in an alternating fashion. For an inversion ankle sprain, for stirrups, you would start at the medial malleolus, which is a bump on the inside of your ankle, and work your way around the bottom of the foot all the way to the lateral malleolus. For horseshoe, you start at the top of the foot and work your way around the back of the heel all the way to the back to the top of the foot in a horseshoe fashion. I will now complete 3 sets of each of these in an alternating fashion. As I tape, it's important for me to remind myself that the leg is cylindrical and not round. So if I do not keep the tape at an angle as I tape, then it will not properly apply itself to the foot. I will now apply one figure eight, which helps add strength to the ankle as it performs dorsiflexion, or in other words, upward movement of the ankle. I'll start at the top of the foot and go around the back of the ankle and then underneath in a figure eight fashion. I'll now apply 2 heel locks to both sides of the ankle. I'll start at the top of the foot and go underneath and then around the back of the heel, locking it into place. I'll do one more on the right side. And then 2 on the left side. I will now finish my taping by applying one more figure eight. And I will close my taping by starting where I finished my last figure eight and wrapping all the way to my proximal anchors. Now that I've finished taping, I will check for the capillary refill in the foot to make sure that circulation has not been cut off. I will check for capillary refill by pressing on the nail bed until it turns white. Once it does, I will release pressure and wait for it to return to a normal pinkish color. If there's good blood flow to the nail bed, a normal pinkish color should return in no more than 3 seconds. Now, in order to check the integrity of the tape, I would have the athlete warm up for 20 minutes because athletic tape loses 40% of its elasticity after 20 minutes of warming up. If after warming up the tape still feels too tight or too loose, I would retape it. Now, while this is the most common form of taping, it is often altered for a specific sport. For example, in football, they often like to tape over the shoe because it provides more support to the ankle joint. So in summary, I will have successfully provided stability and support to the ankle by applying a series of stirrups, heel locks, and figure eights in an alternating fashion. In conclusion, athletic taping offers enhanced proprioception, or in other words, kinesthetic feel to the athlete's ankle as he runs and changes directions. This improved coordination can not only be beneficial to someone making a quick change of direction or planting their feet, but it can also help to prevent a future injury. So in about 3 minutes, one can effectively manage injury to the lateral ankle by specific applications of basic athletic taping.